C'est quoi OPISMS?
Rappel des dates de vaccins par SMS.
Well, this reminds you when you have to get your vaccines through message text, and also security for all the data concerning vaccine. With the electronic vaccine certificate, our family is secured. So you need the vaccine to feel more secure. That's nice. That's nice because this is a specific message for Africa. And I must say that we don't have many initiatives of e-health which are based on a national television campaign. And this is a very good coverage for your population. So maybe you could tell us more about OPSMS vaccine. Yes, good morning. I am in charge of this project, and I'm manager of OPISMS, or associated manager, since 2014. And this service is a web service which gives the possibility to the subscribers to receive reminders on a regular basis through mail messages or text messages. So the group is EvoCard Abishop. It's been implemented since 2011. We have a specific agreement with the Ministry for Health. It is a convention, an agreement. What we want to do is to improve the access and the quality of health care for our populations, our poorest population, and thanks to the IC. And this is something which is a priority for us because we have bad practices in terms of health. Some people don't even get the vaccines they need. Sometimes we lose track of our patients and we don't even know what the health care they're provided with are all about. Now, what about coverage? As you can see here on this map, we have two kinds of population. In orange, you have the subsidized areas, thanks to NGOs and International NKI, which is one of our partners, and they've really been supporting us throughout the project. That means that if you have an upfront payment for the populations at the northern part of the countries, well, this gives access to health care to most of the women and children coming from Borobo, and that means that they can get their vaccines, and that we have an improvement of 17% with respect to the overall vaccine coverage. In orange, these are the subsidized areas, and in green, the non-subsidized areas. So as I said before, in orange, you have subscribers, and they have been paying 1.5 euros per year. For this subscription, we have more than 500,000 persons who are subscribers, and 135 health centers in Ivory Coast which are covered. We have approximately 8% of coverage as it stands today. Now, OPISMS vaccine, well, it's based on informed consent because the patient comes to see us and we present the service. We tell him about the confidentiality of the data and how we can secure the data. So we ask him his name, his first name, his second name, his age, where his address, his phone number. This is the basic data that we require. This is 1.50 euros. And then he will receive reminders through text messages and by mail. So he can also consult online all the information provided on the vaccines. He can also secure all the data concerning the vaccines which have been performed. He gets an access to all the data concerning his health and hygiene. This helps us when it comes to issuing the vaccine certification. It's easier to do this through internet, and it also provides us and provide our patients in real time with the statistical data concerning their health. It's a very useful tool when it comes to the decision-making process. Now, what about the prospects? We hope that we will cover 1,700 health centers in Ivory Coast. For the moment, we only have 135 health centers. And I said before, we're not always receiving any financial support for this. So we have to reinforce our partnership with international organizations. We have to automate the intake and the updating of all this information, especially when it comes to disseminating the reminders. We also have to invest in other health areas, nutrition, malaria, HIV, education, agriculture, business or commerce. We have to develop new operational research so as to support these projects and find new financing for the rollout of this system in Ivory Coast. We need to find more financial support, as I said before, more subsidies coming from the companies which could be interested by the project. Now, this is what it looks like. This is a certificate for vaccines. So this is what it looks like. Just in the upper part, you see here the number, the code of the patient, his birth date, his name, and so on. So all the information concerning the patient. And in the lower part, you have all the information concerning the vaccines which have been performed on the 13th of March 2013. There was a first vaccine and a reminder for the year after. So there was a meningitis, anti-meningitis vaccine. And we also have the number of the batch of the vaccine which has been performed. Here you have a definition here of the vaccine. That means there is really all the data we need concerning the vaccine. Thank you very much. Well, thank you for this wonderful presentation. And OPISM, we see here that education sensitization is something which is clearly in line with vaccines. So there's a question I would like to ask. Who are the persons that you have? Are they equipped with mobile phones? Do they have internet? Is that the kind of populations you have been able to treat? No, in fact, I would answer by saying that we are concerned about different kinds of populations and patients. For instance, we can also have text messages, and the health centers sometimes are close to where the people live. So this makes things easier. This is what we try to do, develop the health care centers close to villages or where people live. We also have a stand where we have all the information which can be provided to future subscribers, and we explain to them how this service works. Now, another comment which I would like to make, and a question too. Now, if you propose this service to a patient or a user, even though it's not very costly, then it seems that people accept this. They pay quite easily for this service. Yes, well, this is not a lot, maybe for you, but it's more in Africa. €1.50 is quite a lot for some of our people in African countries, even though it doesn't seem to be very costly. For instance, you have some people who live in very remote areas and who don't even want to be vaccinated, even though it's free, because they don't get the information. So I would say that it's not really the cost, even though it could be quite costly for some people. It's not the cost. I think it's really a lack of information which can account for the fact that vaccines are not being performed. So in some cases, you only have 47% of the population which is covered by vaccines. No, that doesn't mean that all these people are subscribed to our services. Now, what will happen in the future? Does this mean that you're going to have to find agreements with telecommunication operators? Answer, yes. I think we're going to have to develop this kind of partnership in the future.